Displaced by some of the worst flooding in years, hundreds of thousands of Pakistanis now face the threat of disease.
Infections are on the rise due to unsanitary conditions, and health facilities damaged by historic rains are struggling to cope. VOA's Sarah Zaman has more.
In makeshift tents pitched along roadways, flood victims wait for aid to arrive.
We have nothing to eat. Our children call to us for food day and night.
They were already fighting hunger and heat. Now they're also facing the threat of disease. As waters from Pakistan's worst flooding in years recede, cases of malaria, dengue, diarrhea, and skin infections are rising. Healthcare workers are seeing thousands of patients for mosquito and waterborne illnesses every day.
This is mosquito season. There is a lot of stagnant water in which mosquitoes are growing. September and October are months when we generally receive a lot of malaria and dengue cases due to mosquitoes. That is why we are receiving cases of malaria at flood relief camps.
Large swaths of land across Pakistan are covered in water that could take months to dry. With no sanitation facilities or clean drinking water, many are turning to these germ-infested pools of stagnant water for daily needs.
It is very, very hot, and we do not have any drinking water. But lots of flood water has accumulated here, so we come here to drink this flood water, as well as to bathe in it, to cool ourselves. We have no other option.
Unusually heavy monsoon rains and devastating floods have killed over 1,500 people in Pakistan since mid-June, including more than 500 children. The natural disaster has affected over 33 million people, roughly 15% of the country's population. The spread of gastrointestinal diseases is adding to the death toll. The World Health Organization has warned the outbreak of diseases could be a second disaster.
Since beginning, WHO staff is on the ground. We visiting all the districts which have been affected and supporting with supply of medicines and other logistics. And also WHO staff was much involved with organizing mobile health camps.
But with close to 2,000 health facilities damaged by rains and floods, the country's already weak healthcare system is struggling to serve the rising number of patients.
Challenges are basically arising just because of the destruction of the roads, because they cannot travel so long from their Kalam to this area. This is, I think, the only health facility left here. So it's difficult for them to travel too long to be here.
Health officials are urging people to take precautions to prevent the spread of disease. But for those who have lost almost everything in floods, there's little protection. Sarah Zaman, VOA News.